Hey guys, this is day 2 of your health accountability. Did you take your fiber today? Did you take your fiber today? Okay, I'm here to hold you accountable. This is day 2. We're going to just get this thing started here. Women, 25 grams of fiber a day. Men, 38 grams of fiber a day. Did you get that? Because I bet you probably did not, because 95% of Americans don't get their daily fiber intake. Because 38 for men, 25 for women is like pretty hard, okay? For breakfast today, I had oatmeal, which is about 4 or 5. I had 2 apples for a snack, and then lunch I had a big head of cabbage, some broccoli, and some cauliflower, which is like around 10 or so, all right? So the 5 of oatmeal, 4 or 5 of oatmeal, the apples will be like 10. Lunchtime is 10. Dinner I had some sushi and some avocados, and I'll have my Metamucil and my fiber gummy supplements, and then I'll have a pear. So that 10 plus the pear, I'll be like a little bit over 38, maybe close to 40, maybe. And I just barely did it today. So I'm holding myself accountable, and I'm gonna hold you accountable. Did you take your fiber today? Okay, this is day 2. We're just getting started. Let's see how we feel. Let's see how we do, all right? Just a month of this. If you follow me along, maybe 30 days, see how things change for you. But ultimately, I think it's a great long-term journey for setting health habits for your future. So join me, all right? Today, I'm going to talk a little bit about signs and symptoms and what colon cancer is. To keep it brief, colon cancer is cancer of your colon, which is your large intestine, right? And it starts with an abnormal growth of cells called a polyp. It's kind of like a small outpouching in your colon, and over time it can turn cancerous. The issue with that is it can grow and grow and grow. The larger it grows, gives it an opportunity for it to spread to the rest of your body. If it spreads, that becomes metastatic colon cancer, and the survival rate is very low for that. All right, so we don't want to be there. We don't want to be a statistic. Let's do the prevention with fiber. All right. Some signs and symptoms that you want to watch out for are vague cancer signs. So you have night sweats, where you're just sweating in the middle of the night. You're not sick, but you have night sweats. You have unintentional weight loss. Let's say you're not trying to lose weight with exercise and dieting, but you're just losing weight. Some other signs and symptoms are vague abdominal pain, changes to your stool, changes to your stool frequency. For example, having a lot of constipation all of a sudden, or diarrhea, and even bleeding, right? If you have bleeding down below, that's usually not very normal, so you should definitely get that checked out. And then there is the classic sign of a pencil-thin stool. So if you think about it, if you have a mass that's growing in your colon, it can block your stool. So whatever comes out on the other side when it's being pushed will come out in a very thin, pencil-like stool. So if you have something that's really thin, right, it can be a little concerning, and it should be something that you should get checked out. So that's just it for today. A brief dive into some of the signs and symptoms that you should be looking out for. So again, this is just day 2. We're just getting started. I'm holding you guys accountable, and I'm holding myself accountable. Did you get your fiber in? Comment down below if you did or did not. We all make mistakes. We take it one day at a time. Sometimes you're busy. Sometimes life, gets busy, and that's totally okay. Women, 25. Men, 38 grams of fiber. We can do this, all right? I'm going to try and see if I can get this done for 30 days in a row, just 1 month. I'll be back to check on you guys tomorrow, holding you accountable, all right? I'm holding you accountable for your own health. Stay with me here, okay? Join me on my journey. Comment, like, and subscribe. I'll see you guys tomorrow.